Hi, my name's Sheila. I'm a therapist at the St. John Clark Pain Treatment Center here in Clearwater, Florida. I'm here to talk to you today about scoliosis. 80% of scoliotic cases are idiopathic, meaning there's no known cause. So we like to get to the bottom of what the root cause of pain is as neurosomatic therapists. So we look at lower limb length inequality as a possible reason for the scoliosis. What happens in lower limb length inequality, or LLLI, is there is one leg that's actually shorter than the other. As you can see in this model that I've kind of arranged for you, there's a pelvic tilt due to the limb length inequality, which would happen by default. The longer leg would have a higher pelvis and the shorter leg would have a slightly lower pelvis, putting the sacral base at an angle. So the sacral base being at an angle will start to deviate the spine laterally from its normal mid-sagittal plane. Doing that will create a functional scoliosis due to a structural leg length inequality. So what we do here at the St. John Clark Pain Treatment Center is we work with the tissues, the soft tissues of the body, using various massage modalities and techniques. So the soft tissue could be particularly tight in the concave areas of the spine, and they could also be particularly stretched out in the convex areas of the spine. So we systematically work in different ways to relieve the tighter areas and perhaps use exercise in the future to strengthen the convex areas or the stretched out areas of the spine. So this idea of a lower limb length inequality was researched and defined in Myofascial Pain and Dysfunction, the Trigger Point Manual by Janet Travell and David Simmons. This is one of the most important works for trigger points therapy as well as working with a lower limb length inequality. In this book, chapter 4, she describes what could be either an S curve or a C curve in the spine. And it depends upon how many millimeters of leg length difference there are. So if it's 6 millimeters or less, you'll have a C curve, most likely. If it's 10 millimeters or more, your body will start to produce an S curve, having two concave curves. So it's very simple. What we do is also outlined in this book, in this manual, is just simply to lift the shorter side. We put an insert, a full foot insert into the shoe. The problem with using only a heel lift insert is it takes the pelvis into flexion and rotation. So we take the entire foot to lift it up, and therefore you're not creating another distortion. So with that, we start to level out all the bones. We use this charting method as well as an x-ray, which is also the protocol for the x-ray is outlined in Janet Travell's book. And we confirm the exact amount of millimeters of the limb length inequality. And with that, we take that exact amount of millimeters into a foot insert and begin to balance the spine from there. As soon as the pelvis starts to balance, the lateral curvature of the spines will release and you'll find a normal, more normal looking curve of the spine, and you'll continue to work it with manual therapy until balance is achieved and pain is eliminated. So before becoming a therapist at the St. John Clark Pain Treatment Center, I was actually a patient. I had discovered through my years of teaching Pilates and yoga that I myself have a leg length inequality and a structural asymmetry which causes a functional scoliosis. So I'm demonstrating here without wearing my lift, which I normally do wear, the difference of height in my shoulders. Maybe you can see this shoulder is high. We measure at the AC joint. And this shoulder on the right is lower, would be on the left side of your screen. So putting 16 millimeters, which is my amount, so this is 10 and 6, just standing on that, pretty immediately my body recognizes the change and starts to level out the pelvis, leveling the spine, and eventually the entire shoulder complex gets to be horizontal to the ground. So through this work with yoga and Pilates, I've been able to come up with various exercise methods for people with leg length inequalities. It's very simple. So for using Pilates as an example, I'll just take my 16 millimeters and place it against the reformer. And I can go into my footwork on the Pilates reformer, keeping my limb length inequality equal. So one of the things you would like to work on with scoliosis is engaging the transverse abdominis. And through Pilates work, it's
really great way to engage a transverse abdominis and work in a very symmetrical way. However, if you have a limb length inequality without my lift, I feel the springs from the Pilates machine pushing asymmetrically on my body, so the forces are not even. So I simply put the amount of millimeters under my foot and I work that way. For yoga, very similar. I actually use a lift in my yoga practice. So when I'm doing sun salutations, I'll stand on my lift. So I'm very even in my mountain pose. I go through sun salutations. And then as soon as I become weight bearing on the hands into downward dog, I no longer use my lift, I just put it aside and I step the longer leg back. Therefore lifting my sits bones, having an even line on either side of the spine.
This was just an introduction to scoliosis and some of the things you could do at home to help your scoliosis. And in the future videos I will be posting, we'll get into more specific exercises for S scoliosis and for C scoliosis. Until then, thank you very much.